Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health, Dayton, Montgomery County. I'd like to start this news conference today by saying thank you to our viewers. You are holding us accountable. We hear your message of not touching this podium. So we are going to make a full effort today to keep an eye on these things, all right? So globally, we are now at around 400,000 cases of COVID-19 disease, claiming over 17,000 lives. Nationally, 46,000 cases with over 500 deaths are being reported in this country. Ohio, our first case was on February 7th. We stand today at 564 confirmed cases. 49 of the 88 counties have a confirmed case, and unfortunately, 8 Ohioans have lost their lives. We heard a little bit more about the statistics and the breakdown regarding these cases. 16% of the cases, or 91 individuals, are actually healthcare workers, and 145 individuals have been hospitalized. The age ranges are from less than 1 to age 95. Within Montgomery County, we stand at 13 cases. Yesterday we were at 12, so today we're at 13. We have 6 females and 7 males. I won't go through the age ranges. We can get that to you after the press conference. 2 individuals out of those 13 are hospitalized. So our thoughts and prayers go out to those individuals and their family members. And we continue as a health department to do our contact tracing to identify individuals that they may have been exposed to where those individuals can self-quarantine at home. Well, obviously, our true numbers are higher, no question. Some individuals are asymptomatic, they have infection, they simply have no symptoms, but they still shed the virus to others. And we all understand that test kits currently are limited, so not everyone is being tested. So yes, our true number of cases is actually higher. You look at the global, the national, the state, and our local numbers, and it should be clear to everyone the trend over the last 60 days. So we have not yet achieved our goal, and we've heard this repeatedly at the state and national level. We have not yet achieved our goal of flattening the curve. Cases are still increasing. So based on all available information, there are actions that we need to continue to take. So we must continue our social distancing. And we'll talk a little bit more in a moment about that stay-at-home order from the governor. We need to add capacity for testing. And we know that those plans are in the works. We need to extend the use of personal protective equipment, respirators, masks, surgical masks, gowns, and gloves, because we have limited capacity. We need to reduce the burden on our healthcare workers, because they need to be present to care for those who are ill. And we heard today that we know we need to increase hospital bed capacity, and we heard Director Acton from the Ohio Department of Health say we may need to increase bed capacity by almost 50%. So we know that modeling is underway by the Ohio Department of Health, by the Ohio Hospital Association, Ohio State University, and the Cleveland Clinic to try to predict actually how much bed capacity we're going to need. And we know that our local partners are working diligently on that issue as well. So just briefly on the stay-at-home order, and we realize that this is creating a lot of questions throughout this community and across this state. It's today through April 6th. It's very clear that non-essential businesses and operations must cease. So we understand the categories: healthcare and public health, human services, essential government functions, and essential infrastructure. Those are the 4 broad categories. And then the order contains other categories, specifically 25 other categories. And if you look through the order, it's item 12, letters A through Y. There are certain things, and we'll talk about essential businesses in just a moment, but certain things must be done by businesses if they're classifying themselves as essential and they continue to operate, because they must provide a safe work environment. That means working from home, To the extent possible, all workers should be working from home if possible. Comply with social distancing if workers are reporting to a work site. You need to monitor employees for illness, send them home if they're symptomatic, consistent with COVID-19 disease, establish flexible leave policies. We can't say it enough, clean internal surfaces. Commonly touched surfaces should be disinfected routinely throughout the day. Limit in-person meetings, obviously to comply with social distancing, avoid congregate areas in the workplace, and make sure that hand washing and hand sanitizers are readily available. So on this stay-at-home order, we need to be very clear in Montgomery County. Public Health Dayton and Montgomery County's mission here is to protect public health. That's what this stay-at-home order is intended to do. Please understand, we will err on the side of caution to protect public health and to assure compliance with this order. Yes, we are receiving inquiries, and quite a few, regarding what is essential and what is not as essential business and operation. And we're working through a process with our other local health departments in our region, as well as our state partners, to reach consensus on what that means. But we need to be very clear. We are not going to add language to that order to try to make non-essential businesses fit one of those categories. This is about workers staying home unless the business is absolutely essential. And unless a different decision is made at the state level, then the decision we make in this community is final. So one particular business category keeps surfacing, and we've received multiple calls on our information line, and other community partners have received these calls as well. And that's the lawn care service sector. So I need to be clear that Public Health Dayton and Montgomery County is classifying lawn care services as non-essential, and those operations need to cease. If a decision is made otherwise at the state level, we'll revisit it. So, obviously, our information line remains open. The number is 937-225-6217. We encourage individuals to contact that information line. We realize there are a lot of questions. We have a dedicated staff working Monday through Friday from 8 to 6, Saturday and Sunday from 10 to 6, to make sure that we can answer the questions that our community raises. Today, we're very fortunate to have a variety of speakers. We have Mayor Nan Whaley from the City of Dayton. We have Shelley Dickstein from City Manager, City of Dayton. Elizabeth Lawley, Superintendent of Dayton Public Schools. Phil Parker, President, Dayton Area Chamber of Commerce. Helen Jones-Kelly, Executive Director, Alcohol, Drug Addiction, and Mental Health Services. Paula Thompson, President and CEO, Fidelity Healthcare. Teresa Williams, Chief Operating Officer, CompuNet Clinical Laboratories. Rick Kryzak, Vice President for Facilities Management and Planning at the University of Dayton. And then Sarah Hackenbrack from the Greater Dayton Area Hospital Association. And with that, we'll ask Mayor Whaley to come to the podium.
Thanks, Commissioner. I'm going to fix this. We're getting some conversation about some static, so it doesn't really work if they can't hear you. On the middle part? Better? We'll see, right? Hey, well, thank you all. Thank you all for coming. Commissioner, thank you. Thank you for all of our guests today with some pertinent information. I'm going to call the city manager up in a moment for some of the actions that the city has taken during these unprecedented times. To reiterate what the commissioner said, we are getting a lot of calls at City Hall as well as our police departments about what is essential and non-essential. I'm going to reiterate what the Lieutenant Governor said at his 2 o'clock press conference, that it is really on the business to make the decision to read the order and decide if they are essential or not essential businesses. We'll try to give direction as the commissioner did. I want to commend the work that he's doing with the 9 other county health departments to come together and come to agreement, so there's less, well, this works in one county and not the other, but the county health department is the place that we will enforce this in partnership with City of Dayton Police. We're also encouraging folks, as they need resources or have questions about resources, to call 211, which is the United Way helpline. We have lots of folks that are doing great work around the helpline today. We had a call this morning with all the different folks really trying to focus in on food and children, which is a big focus for us as we continue to move forward with this. Look, I think we're getting ready to get into the heart of this issue as we've prepared for the past, in some cases, like public health has been preparing since January. Some of us have started preparing in the past month, and some of us have been in action for the past 3 weeks. And so I just want to remind everybody to give each other some grace and some space. This is where we're going to get into the tougher time of this, and to have patience with one another as we continue to make sure you stay at home. I know this is incredibly difficult. We have a tendency to want to just go somewhere once a day, take a walk. If you need to go somewhere, just take a walk around the block. Please stop the want to go to the grocery store just to go to the grocery store. We're going to encourage people to really separate those grocery store trips as much as possible, and really encourage people to stay at home. I also want to thank Dr. Doan. We did a Doctor Is In that I thought was very helpful. You can watch that on Facebook as well. I appreciate all the good work that Public Health is doing. I want to call forward the City Manager, Shelley Dickstein, to talk about what's going on with our staffing at City Hall. Okay, one second, Shelley. It's like technology is great until it doesn't work, right? Sorry. Thank you, guys. Okay. Shelley, let's see if they can hear you.
Well, good afternoon. In response to the governor's stay-at-home order, as well as to do our part in limiting the spread of COVID-19, we sent home approximately 600 non-essential staff to stay at home and limit the workforce at the city of Dayton. Represents about 31% of our workforce. I just want to take a moment to characterize the situation. This is absolutely extraordinary. Never in our modern times have we had to resort to, sending a third of our workforce home. But we know it's really important to thin out our employees and to really model the way for the community to stay at home and limit exposure to this virus. So we are trying to do our part. Now let me also say that all of our 1,900 employees are critical and valuable and an essential part of our team in serving our 141,000 citizens. However, at this time, for the critical mission of this emergency, we were able to identify about 30% that we believe we can send home and have them stay at home safely while this virus is spreading. We also want folks to know that some of those employees may get called back if we experience a great deal of absenteeism due to health or quarantine situations. So at this point in time, they are at home. It is effective up to April 13th. We put a little extension on the governors because we wanted to be able to, it's very painful and takes a lot of work to move that kind of number of employees back and forth. So we were trying to provide a little bit of cushion there so we wouldn't have to be changing the wheels on the bus as it's moving. All of our employees were given an option to utilize their leave so that they would hopefully not have a long duration of unpaid time at home. So they could either utilize existing leave balances or even go into a deficit situation and spend future leave. Or if they elected to stay at home unpaid, which some have because they are in a situation where they can, they can also apply for unemployment. So we were trying to make sure that we're taking care of all of our employees at this really critical time when so many other people are being impacted by, with their resources and their jobs. Just to reiterate, the essential services that we have defined for this particular emergency include staffing from police, fire, water, aviation, and public works, as well as essential financial management services, business assistance services. If you read the order, you will realize that there are a lot of businesses that were exempted or excluded. That means that as we are providing service, our government has to be in a position to respond and support those services. We've been spending a lot of time primarily monitoring our economic impact, talking to businesses that have been impacted, making sure that businesses are following guidance even if they are an essential business, so that the social distancing, the actively monitoring health, as well as not having large shifts or groups of employees gathering, is being followed closely by our essential businesses. Any of our staffing that were able to report or work remotely were directed to do so. Those that have to report in to the work site are practicing social distancing. We are actively monitoring their health as well as the health in their households. We are aggressively desanitizing hard surfaces twice a day and in between. So we are doing everything we can to protect our existing workforce so that we have limited impact from the exposure.
Thank you, City Manager. Appreciate your leadership during this difficult time. Next, I appreciate Commissioner Cooper letting the Superintendent of Dayton Public Schools come forward, Libby Lawley. Quite frankly, Dayton Public Schools has become the safety net for our children during this time and have done a pretty tremendous job by working with volunteers and the community, and wanted her to come forward and give an update to the community on just an amazing job that they're doing.
Thank you, Mayor, and thank you for allowing me to speak today. First of all, I want to thank everyone who has helped Dayton Public Schools feed and educate our students. Without dedicated staff members and community volunteers, we would not be able to continue to feed and educate them. Tomorrow is a weekly food distribution day from 9 o'clock till noon at the same sites for Dayton Public School students. We're changing our process to help everyone remain safe. Weather permitting, we will do a drive-up distribution. You and the DPS students remain in your car. A volunteer will check you in and bring food to you so that you can load it into your car for the following week. If weather is bad, you will need to come into the building but follow the directions of the school resource officers to keep a safe distance. It is important that everyone keep a safe distance no matter how long you are there in the building. Tomorrow, students will also receive a backpack of supplies donated by Crayons to Computers, and we will also have a variety of books donated by the United Way for students to choose from. Again, social distancing for this option will be practiced. In closing, I'd like to thank everyone for their ongoing support of the Dayton Public Schools. I thank you so much. And at this time, I'd like to have Dr. Gary Dickstein, the DPS Business Director, to review some of the work that's occurring to ensure that our buildings are safe once we return. Thank you.
Thank you, Dr. Lawley. Good afternoon. In an effort to make sure that we're being extremely diligent in ensuring the safety of our teachers, our staff, and our students, and even our volunteers that are helping us right now with food distribution, we've been aggressively starting to clean and disinfect every facility that we're responsible for. Currently, we have over 25 schools that we are in the process of identifying a schedule to go into every classroom, every hotspot public area, every drinking fountain, and any other orifice you can find in the school district will be cleaned and disinfected. For our schools that we're currently using as food distribution sites, we are actively cleaning those as well and disinfecting those after every time that we use one of those facilities to distribute food. And so it has been a team effort. We are super proud of the staff at DPS and the amount of students that we've been able to feed. And the operations division of the school district is working very diligently to ensure that when we're ready to reopen, everything will be clean and safe for our students to come back and start learning again. Thank you.
Next, we'd like to introduce Phil Parker, President, Dayton Area Chamber of Commerce.
Thank you, Jeff, and thank you for inviting me today. And Mayor, City Manager, Superintendent, and others, thank you for all of you being here today. You know, when we look at this, what probably just started out in some of our thoughts was a health issue, has certainly gravitated to more than that. And unless you're out there in a cocoon somewhere, this is a two-issue piece that we all must deal with. You know, Jeff and others have been talking for days now, and others will continue to talk about the health issue that we must do. And I'm going to make some comments about some of that remotely about business. But there's also this economic piece that we also have to be concerned with, because we will get over this, but it's affecting a lot of businesses. It's affecting a lot of people that are employed or maybe waiting to be re-employed back in their businesses. There's really going to be some real challenges that we must deal with. But let me just say that the community leadership has really stepped up, and I am so proud of the people, whether they're elected officials, appointed officials, business leaders, or civic leaders. We've come together and we're really starting to figure out how we can all work together to make sure that both of these challenges are going to be fixed. And we will get through this. But let me just share with you a couple of thoughts that I have about the business community. You know, we've seen the order about essential business. And I want to make sure that I say this as clearly and as factually as I possibly can. May not be what everyone wants to hear, but I'd rather just tell you the truth as I see it. We do have a list of what is essential. I'm not saying there hasn't been people that have questioned that, but first of all, it's upon the employer to look at this order and determine if they are part of this essential business order or not. If there are questions, there are resources that we would encourage you to go to. Certainly, a business usually has legal counsel, HR professionals that are out there. There are others that can help. But this is very important because I think it was Jeff that said, you know, we've got to get to this point where we flatten out this curve. And there are people that are still getting their arms around that because some of the actions that have been taken have been quite serious. But we've got to get to the point where we flatten this curve so we're on the other side of it, so we know where we stand, especially in getting people back to work when we can, but also for the healthcare providers. And I'll use hospitals as an example. We never want to be so overrun like others. I was told Northern Italy was an example of this. I'm not there, but this is the thing that I've read, and we don't want to get to that point. We want to make sure that we can care for our people. So it is important that if you are an essential business, that you stay in business. If you're a non-essential business, we ask you to abide by the order and have your people work from home. And hopefully we can get through this. I say to you, this essential business order is clear. We've read it. We're not legal counsel. We've not tried to over-interpret it. like Jeff or someone said earlier before, we're not adding people to the list, but there are some businesses that clearly qualify, and there are businesses that part of their business might qualify. Our Chamber of Commerce, we're a regional Chamber of Commerce, been around for a long time. We are in business. I started having my staff go remote probably 3 or 4 days before the order even came out. All of my staff, thanks to all of our businesses in the community, have allowed us to have the tools for us to work at home. So we've done that, and I wanted to make sure that you know that we are open, and we are talking to businesses every day, especially now that we've gotten the final full approval of not only the state, but the federal government, especially on SBA loans. So there's a lot of folks that are going to need assistance, a lot of businesses that are going to need assistance in the near future. Our chamber has also been in direct contact with the governor's office and almost daily contact with the lieutenant governor's office. And I think you all know that we are blessed with having both of those men have great ties to our community. And we want to make sure that we're using those relationships to better understand how we can serve the business community. Again, I encourage you, if you need professional help, there are professionals out there. But I also want to encourage you to go to other resource guides. The Chamber, on our website, www.daytonchamber.org, we have a resource guide that can help you. And let me just give you a couple of examples. There are businesses that need IT help, and we have IT professional businesses that are out there. Though they might be working remote, they can help you. Number two, there are logistical companies that are chamber members. You might have a need, whether you are a food store or some type of operation that needs delivery of product. Those are allowed, and we have certainly a list of members that you can contact. And third, we want to make sure that you understand that we need to have you in that business. If you're essential, you need to listen to the governor's comments about staying safe, secure, and doing all the things that you must do to remain healthy in that business. And that might include hiring an outside additional organization, which maybe we can help you with, that might do additional cleaning. Some people are using the term deep cleaning. But I want to make sure that you know there are organizations, people, and businesses out there that can provide some of those services. So I encourage you to, if you're essential, understand that. But if you're non-essential, we need you to listen to this order and obey this order because, again, we have to get over this big curve and get to the point where we're on the other side of it so that we can start straightening out the second piece of that, and that's the economic benefit and needs and concerns that we have in this community. Thank you, Commissioner.
Thank you, Phil. Next, we'd like to introduce Helen Jones Kelly, Executive Director of Adamus.
Thank you, Jeff. You know, when I arrived here today, I told a few people how good it feels just to be around people right now. As we have been what we're calling social distancing, which I'd rather call physical distancing, it's tough. It's tough for a lot of us. As I look around the room, there's so many folks that I know to be extroverts as I am. And extroverts draw their energy from other people. So it gets really tough when you're sitting at your own kitchen table for hours on end without that physical contact. But I can't say enough about how important it is, while remaining physically distant, to remain socially connected. Since we came to this room this afternoon, we've gotten a piece of news that I'm going to share with you, which really, I think, brings that point home. Our overdose deaths are climbing. Since the start of March, we have 31 people who have died by overdoses, ranging in age from 24 to 62. We have to find ways to stay socially connected to one another and to provide the supports so that all of us as essential citizens of this community are here when we get to the other side of this plague. So what I want to share with you are some of the tools that Adamus is attempting to provide. We're quickly changing our website. It's been updated. We have updated our app, and we want to encourage people to go to the website to get information if they're starting to feel really lonely, really isolated. It's normal to feel that way with all of the dictates that we're operating under right now. But it's also normal to ask for and to find help to get through it. We have just launched a warm line in partnership with Goodwill Easter Seals of the Miami Valley. A warm line is a number that you can call and get assistance with emotional supports, information, and just having somebody on the other end of that line who can listen to you and talk to you. That number is 937-581-7777, and it is open Monday through Friday from 11 a.m. until 7 p.m. We're continuing our crisis line services. If you have a real emergency, we want you to call Crisis Line, Crisis Care, to get assistance. And many of you know that number, 937-224-4646. These numbers are also on all of our websites so that you can access them as you need them. The idea of the warm line, though, is that it takes the emergency calls off or allows crisis care to handle the emergency calls while the warm line provides the emotional support that may not be an emergency, but certainly it's urgent if you're beginning to feel like you're going to use. We know that people are using substances again. We have been there. We know how this story ends, and we want to get in front of it to the extent that is possible because we really do want to save lives. We would encourage people to reach out to one another. Just because you can't go out of your homes and connect, and we do want those house parties to stop, we do want you to still reach out to others, check in on them, be in constant communication. There's so many ways to do that. There are a lot of tips and tools that are available on all of our websites. We would certainly encourage you to download the app, Get Help Now, Montgomery County, so that you can have access to information. When you need it, we're there. Like everyone else, we're trying to telework. So we have a number of people who are not in the office on a daily basis, but just because we're not in the office doesn't mean we're not available to you. We are not closed. We are there to help. Give us a call, go onto the website. Please do not turn to drugs or other elements that took us to a place in the last 5 years that we do not want to return to. We encourage you. We know what we can do to avoid that, and we encourage you to please reach out to one another. Use the tips and tools that are available. We certainly want to thank the community for the way in which it's coming together, because that's what we do. We know that we're resilient. We know that we can get through this. We want to thank our health commissioner for his leadership on this, and the mayor, because every day the story gets to be a little bit different. I'm telling you today that our overdoses are upticking, and it's not the direction in which we want to go. So join all of us in being sure to engage in healthy alternatives while we're going through this crisis. We're all here to help. I beg you to take advantage of it. Thank you.
Thank you, Helen. Next, we'd like to introduce Paula Thompson, President and CEO of Fidelity Healthcare.
Good afternoon, everyone. I'm here today to talk about a partnership that we developed through Premier Health, CompUNet Clinical Lab, and University of Dayton to stand up a testing collection site at the University of Dayton Arena. The reason why we looked at doing this is that, again, we wanted to support the community, but also support our emergency departments, our physician offices, urgent cares, and others that were receiving numerous calls and were being inundated with patients wanting to have these testing procedures. So there was a mechanism for us to develop and design and stand up an outdoor-based testing collection site. And so through that, we were able to utilize all of the resources that we had. I'm sure that you all have heard is that there's limited amount of testing supplies, there's limited number of healthcare workers, as well as the personal protective equipment that those individuals need to protect themselves from the virus. So by centralizing this process and having it in an open air concept, we were placing these healthcare workers at less risk and being able to prevent that clogging up of our emergency departments, physician practices, and others, where the testing can be done in an alternate site. So I wanted to walk you through a little bit of how the process works. So patients, it is a drive-through process. Patients come to our collection site in their cars. There's an initial registration that's performed on those individuals. We are asking that patients have come with receiving a order from their physician for the testing process. After we verify that that order is received, a screening does take place to identify if you are currently having or displaying some symptoms of the virus, whether it's a fever, looking at those that have had risk of exposure. Once that criteria is identified, patients then are directed through our drive-through system. So patients who have not had flu shots are then directed to a flu tent. An initial flu testing is performed. So if the patient does have the flu and they're positive, they will be redirected and they leave the facility. They then do not qualify to have the COVID test at that time. If patients come through and are tested for flu and they test negative, then they proceed to our second area, which is our collection process for the actual COVID test. So there's a nasopharyngeal swab that takes place. There are professional providers, nurses, as well as other physicians and advanced practitioners that perform that swab testing. That test is collected, that specimen's collected, and then that's provided to CompuNet Clinical Lab, who then manages that. So, you know, in order to make this process smoother, I think there have been a lot of things that we've learned. We've actually been up and running for a week today, and in looking at the total number of people that have gone through our drive-through process, we've had about 1,352 total people through that process, averaging about 250 or so per day. When we look at how this has really helped, I think, for the community, this was really for the public health process to help facilitate, again, and preserve those supplies and the healthcare staff that perform these services for all of us. I think when we look at things that have really gone really well, we have had much improvement over the week in the time frame in which we have the throughput of these patients going through. We've had some excellent results in surveying patients and had some scores that really reflected that our healthcare workers were highly professional in providing an excellent service to these individuals that really come through quite concerned, of course, because of their potential condition. So I think in looking at this, there are definitely some benefits to the overall health system. Helps reduce, again, that utilization of resources that can certainly be better spent with patients and illness, and with the analysis of that we potentially could have a surge in this, it really does preserve those services. So I do want to introduce next Teresa Williams, who's the Chief Operating Officer of CompuNet Clinical Lab, to provide some additional information on the actual testing process.
Thanks, Paula. My name is Teresa Williams. I'm the Chief Operating Officer of CompuNet, and we're proud to collaborate in this effort to expand coronavirus testing to the community. CompuNet has a broad reach, and we serve a variety of health systems and independent physicians across the region. Supplies, just as you hear in the media and here today, are indeed a finite resource, and we are diligently working to manage the inventory of both our collection and our testing supplies. Our first priority is to ensure we can provide testing to those most critically ill that present to the emergency rooms and those hospitalized. Our second priority then is to provide testing and collection supplies for the collection center. Each day we debrief to ensure we have adequate supplies in this pipeline. To maximize our supply level, we've created a process where we can perform 2 tests on 1 nasopharyngeal swab. Last week at the collection center, we began testing on symptomatic patients who present with a physician order. We follow an algorithm that has been given to us by the CDC. 1 swab is collected, and it is picked up by a CompuNet courier every 2 hours and transported back to the laboratory located in Moraine, where it is processed for testing. We first perform a screening test using PCR, where we're looking for the presence of 21 respiratory illnesses, ranging from influenza A and B to RSV and bacterial pneumonia, among many others. If organisms are present, they are amplified and detected by looking for the unique genetic material. Each organism has its own fingerprint, if you will, that allows us to provide definitive identification. We have performed nearly 1,300 of these screening tests, with about 25% of these showing positive results and providing diagnosis other than coronavirus. For those patients whose specimen tests negative, we send out that same sample for detection of the coronavirus called COVID-19, and it is sent to our reference laboratory, Quest Diagnostics. COVID-19 testing occurs in the same manner I described above, where if the organism is present, it is amplified, and its unique genetic material is detected. Again, COVID-19 has its own unique DNA profile. Originally, we were routing specimens to our reference lab in California, but then Quest added a second testing facility in Virginia, and we rerouted specimens here to help us achieve faster turnaround time. We are seeing results back as quickly as 3 days, but on average, we're running 5 to 7 days. The turnaround time does vary based on the shipment, which includes weekend flight schedules and the demand for testing at these facilities. To date, we have received about 450 COVID-19 results back. Results are reported electronically to the physicians. Positive COVID-19 results are called to the ordering physician, to the Ohio Department of Health, and to the Public Health Department where the patient resides. Lastly, I would like to add that we at CompuNet are actively working to perform COVID-19 testing here locally in our laboratory. At this time, I cannot give a definitive time as to when this will be available, as the manufacturer is first sending to those areas hardest hit in New York, Washington, and California. The CompuNet team is testing around the clock to meet the demand, and we're proud of our work in this effort. I'd like to turn it over to Rick from the University of Dayton.
Thank you, Teresa. My name is Rick Krishak. I'm the Vice President for Facilities Management and Planning at the University of Dayton. And I want to thank everybody for giving me the opportunity to come before you and describe how we got to where we are today at the Collection Center site. We're proud to partner with Premier Health and CompuNet in establishing this regional collection center. The work is important to the university because we're an anchor institution in the city of Dayton, and because our Catholic and Marianist tradition of helping our community in times of need. The setup and logistics of running the collection site at the UD Arena have been successful, thankful to in part because of our working relationship with Premier Health and our CompuNet partners. We've received daily feedback from the medical professionals operating the center, which has enabled us to make needed changes to improve the process. When the pandemic began to impact us locally, UD was getting ready to host the NCAA First Four games at the UD Arena. Right after the games were canceled, Premier Health and CompuNet reached out to us about partnering on the site. We were able to take existing resources and pivot them to focus on supporting the regional collection effort. We had an amazing first day. We met for the first time as a full group at the UD Arena at 8 a.m. on Monday, March 16th, to determine how to set up the site for optimal patient flow. We quickly developed an initial site layout and started putting up tents and traffic cones and had materials in place later that same afternoon. We had the site set up by the end of the day on Monday and were open to receive the first patients by 10 a.m. Tuesday morning. Since then, we've been monitoring the process daily and making adjustments to improve patient flows, which has reduced the amount of time it takes a patient to move through the collection center. UD support for the collection center is truly a team effort and goes deeper than just providing the site and initial setup by the arena staff. UD's dining services provides daily lunches, water, and coffee. UD Student Health Center personnel have been providing assistance on the line at the collection center with our partners. And UD's Public Safety Department has been assisting with security at the site. Today, we believe we have an effective and efficient site set up that allows our medical partners to safely and effectively provide service to the maximum amount of patients possible. UD will continue to support the collection center for as long as needed. Thank you very much.
Thank you, Rick. And now we'd like to introduce Sarah Hackenbrack, President and CEO of the Greater Dayton Area Hospital Association.
Good afternoon, everyone. Yesterday, we talked a little bit about what our hospitals are doing to prepare for this current situation. And a question was asked of all of us here yesterday is, what can each of you do as individuals under this current time to help us prepare for what is coming? And on behalf of our hospitals, our physicians, our nurses, and all of our healthcare workers, we ask you simply to stay home. Follow the instruction from Governor DeWine, follow the recommendation from our health commissioner, and understand that your actions and the actions that you take over the next 2 weeks are the very specific actions that will give our hospitals the best fighting chance that we can have to adequately serve all of the community's needs during what is coming before us with the coronavirus. The more that you stay at home, the more we are able to reduce community spread and protect the vital healthcare resources that we depend on as a community. That means that we would have fewer individuals needing isolation rooms, intensive care units, and inpatient rooms all at the same time. And so we ask you to do your part to help us be prepared to take care of each and every one of you. We did hear from one of our partners who had a very urgent need and ask. And the Community Blood Center did say, if people absolutely must get out and must do something, you can help us in the region prevent a critical blood shortage. Right now, the Community Blood Center has approximately 8 to 14 days of supply of blood for all types that we will need in the coming weeks and months to prepare us for the coronavirus and its impact on our region's healthcare system. That is an allowable activity to go and donate blood at the Community Blood Center, but there are a couple of requirements that you need to meet. First, you need to plan ahead, and you need to let the Community Blood Center know that you're going to come and donate blood. You can do that under 2 ways. One is to call and make an appointment at 937-461-3220. Or you can visit www.donortime.com to sign up for your appointment. That planning ahead allows them to appropriately space donors in the space that they have available for donations and to ensure that there aren't too many people donating blood all at the same time, and it still protects their staffing resources as well. Once you're finished giving blood and donating, then we ask you to do exactly what our governor and our health commissioner have asked, to return back home and stay there to help us flatten the curve over the next 2 weeks. Thank you.